Struggling with sleep is one of the most common complaints that I hear when patients come to see me for a psychiatric evaluation, okay? And while I embody to work on the underlying causes, a select few patients need medication, targeted medications to help them with their sleep, okay? Hi, my name is Dr. Gabriel. I'm a dual certified family and psychiatric mental health nurse practitioner, and I'm going to talk to you about the 4 medications that I utilize in my patients to help them with various sleep issues. You ready? Let's go. All right, the first medication we're going to talk about is Visceral, which is also known as Hydroxyzine. It is one of those old school antihistamines that is FDA approved for anxiety and itching, but it's also used off-label for sleep. It works by blocking histamine, which is a key wakefulness signal in the brain. For sleep, I personally prescribe doses of 25 to 50, actually I lied, 10 milligrams to 50 milligrams as needed for sleep. One of the things that a lot of patients have reported, especially those who are also anxious, let's say their anxiety is a part of the reason why they can't sleep, is that it calms down the noise. It makes it more quiet and they're able to drift off to sleep. One of the nasty side effects of Visceral that people are not too fond of is that it can cause grogginess the following day. Okay, so this is why I usually start my patients on a very low dose to see how they can tolerate it, and then I slowly increase the dose up to 50 milligrams to see if that helps them with sleep. Another medication that I like to use for sleep is called Trazodone, which is also known as Visceral. All right, Trazodone is an antidepressant. However, at very low doses, it helps to promote sleep. What it does is it works on the serotonin receptors that helps to promote sedation at those lower levels. Those dosages are from 25 milligrams to 100 milligrams. Once you go to the 150 milligrams, it's no longer working on the sleep signals. Rather, it starts to work on the antidepressant side of things, all right? So this one is tolerated very well. I don't see much of the grogginess that patients experience with Visceral when they are taking Trazodone. Also, it's not habit forming for those that are concerned about that. Another goodie is Doxepin, which is also known as Silanor, okay? It is a tricyclic antidepressant, but at low doses, 3 to 6 milligrams, it's FDA approved for sleep maintenance insomnia. What it does is it works by blocking the histamine receptors, which helps patients to stay asleep through the second phase of sleep, second half of the night. So it's a really good medication for those who have like those early morning awakenings. And finally, I like to prescribe Mirtazapine, also known as Remeron. It is an antidepressant. However, at the 7.5 milligrams to 15 milligram dose, it can be sedating, which is a reason why providers like to use it as a sleep aid for a select few patients. Now, Mirtazapine is really good. However, it can cause weight gain. Yes, it does increase your appetite. So I only reserve that specific medication for a patient that may have experienced drastic weight loss from either anxiety or depression, or somebody that's already struggling with low weight and they have sleep issues. That they would be a good population to start their own Mirtazapine. All right, so that wraps up the 4 medications I commonly prescribe for sleep. There's some other goodies that are prescribed for sleep as well too, and that will be in a future video. So stay tuned and follow Dr. Gabriel on all platforms. Okay, I am on TikTok at DRG_I Love It Minds, same on Instagram, and